Well, happy, beautiful, amazing day. Dr. Bob Rakowski here, and my special guest today is Dr. Ryan Kane. Now, I'm going to tell you, I said, do you have anything special you want me to say about you in the intro? And he says, nothing special about me, but I'm automatically going to throw that one right out. He's dedicating his life to health. He's helping Indian tribes in Idaho. In our preliminary conversation, I know knows some things that I don't know, so I'm eager to learn and I'm eager to share. Happy, beautiful day. Do you go by Dr. Ryan, Dr. Kane? How should we address you?
Uh, Dr. Kane to the patients, Dr. Ryan to you is fine.
All right. Well, Dr. Ryan, let's start with a nice hello and tell me a little bit about your background. Where'd you come from? How did you get to where you are now?
Well, they found me under a rock in Michigan. Yeah, I attended Georgetown College in Kentucky and double majored in aquaculture and pre-med because we didn't know which direction I wanted to go in. So I developed the very first tilapia farm in Michigan, 10 years ahead of the time, unfortunately. But in the process, I worked at the hospital and decided, I wanted to go back to medicine. So went to chiropractic school, and have loved it ever since. So,
I want to go to that tilapia farm for a second.
uh,
What in the world? How did you get that insight? And then, two, did you do it right? Did you do it clean?
yes, yes. So when I was in college, for pre-med majors, we had to have a double major. The college required that, and I always loved um, science and biology. So I had a professor there that worked at Kentucky State University that was involved in aquaculture, which was a brand new concept to me. And I grew up in Michigan where we had fish and lakes everywhere. The concept of growing fish just never occurred to me. So I did an internship there and just loved it. And so part of a senior thesis, I developed a clean, green biological filtering system. And so then we decided to build it. So I convinced my dad when I came home, graduated school. So we built it and created our own farm, the very first one in Michigan. And had no chemicals. It was totally clean, environmentally friendly, and it worked. So it worked good.
That's the first thing I want everybody to know is it can be done. We can
Yeah.
create clean, healthy food, but the biggest problem with these conglomerates is they don't care about your health, they care about your profits. That might seem like a bold statement, but you know what? Actions speak louder than words. So, one, thanks for being committed to making our food better.
Yes.
Now, what was the edge? What got you into chiropractic? You were pre-med. That's not pre-chiropractic. What
No, it was pre-med. I had every intention to be a cardiothoracic surgeon. I wanted to operate on people, put them asleep, fix them, and leave. I had no intention. I'm not a people person. I'm not a talker. So I know God has a sense of humor because He guided me to the chiropractic where I have to talk all day long, every day to people. So that worked out. So I was accepted to University College, Surgical College. Then I got a second letter saying, "Oops, we matriculated too many," so I had to wait for a year. So that gave me a year to kill. So I worked at a Trauma One hospital in Michigan in the ICU. And so they gave me a lot of experience working in medicine and decided I didn't want to memorize a bunch of drugs. And so at that time, my sister got hurt and no one knew what was wrong with her. She fell off some monkey bars and had a lot of pain walking, and none of the local doctors knew what to do with her. We just happened to have a small chiropractor move into our small little farm town. He had just moved in. Some parents decided, we got nothing else to do, so let's take her there. He fixed her in a week. And so I had gone with her and it's like, okay, that was pretty cool. What'd you do? Why couldn't the rest of the doctors figure this out? And what is this? All I knew was chiropractic was bad and I didn't know why I knew that, but I just knew it was a bunch of quacks. And I don't know where I heard that, but so he spent a lot of time with me. I spent that summer with him, shadowing him in his office, figuring out what do you do. And so when my name came up for med school, I decided to go to Palmer College instead and learn how to use my hands instead of a bunch of drugs. And so I like to joke that BJ Palmer probably rode around in his grave the day I walked in because I'm the very untypical chiropractor. I came from a hospital background, knew nothing, had never been adjusted, didn't know anything about it. So it was a bit of a learning curve. It was a lot of fun and very rewarding. I'm very glad I did it. Like as you know, we help people that no one else helps, and that's very rewarding.
Yeah, I want to get back to this quack concept for a moment. So I think people are waking up to the idea that there is propaganda out there. And there was a very famous lawsuit. It was Wilkes versus the American Medical Association.
Yep.
And the American Medical Association was found guilty of trying to destroy the competitive profession of chiropractic. And you know what they did? They fined them so big that they'd never do it again. The fine, if you're ready for this, do you know what the fine was in that case?
It was over 1,000,000, I think.
Actually, it was $25,000.
Is that it?
Yeah,
Wow.
that's my memory. I should probably go to AI again on that, but we were just all going, "Oh, sure, that'll be a deterrent." Well,
Right.
you certainly know that there is not a deterrent. There's still this propaganda, but it's waking people up, and patients having great experience in your office, in my office, and many other offices. By the way, not every chiropractor out there is awesome. If you go to one that you don't resonate with, go to a different one. Don't shoot down the whole profession. And when I say, but they're not awesome, I've probably met some that aren't awesome, but you want to find the one that's most awesome for you would be good advice.
Right. I work at a FQHC, and we have a lot of medical residents that come through here, and so I have this conversation with them a lot. The youngest generation has no clue of the lawsuit, the Wilkes versus MAA, but there's a lot less attitude also. We don't have to deal with that near as much as there used to be. When I first started practice, it was still very much in the mindset. It was very hard to work with them medical doctors. I was a little different just because I come from the hospital, so I knew their language. I knew how to work in that environment, so that helped me get into the integrative setting. But for a lot of chiropractors, they didn't have that back then. But what I've learned now with the new medical residents is there isn't the attitude anymore. A lot of them have their own personal chiropractors. They value it. They still don't know anything about it. There's still a lot of lack of knowledge, but we can teach knowledge. If you have this right attitude, we can teach.
Well, that sounds like a great advance for really all of the world. But you have a little niche or maybe a big niche. What's your niche? What do you like?
I like chronic pain, so I like to deal with that. So, but the new paradigm has shifted the last 10 years. There's a lot of research done that has totally changed how we address chronic pain. In the past, chronic pain was treated as pain that's been there more than 3 months, and it was sometimes considered permanent. And there was nothing anyone can do about it. Learn to live with it. So there are techniques to learn how to help patients cope. How do you teach skills to just put up with it? Now we know that it's coming from the brain, and you can rewire it, and you can actually eliminate pain. So it's a very cool concept that's helping millions of people. 100 million people in the US have chronic pain. That's more than heart disease, cancer, and diabetes combined.
Well, and then look at the fallout from those opioids, and even before opioids, there was NSAIDs and people dying from GI bleeding, and then they came up with those cyclooxygenase 2 inhibitors that they thought would be so amazing, and those ended up killing some people too.
Yeah.
But when you talk about rewiring, we're creating new connections. And here's a simple statement: neurons that wire together, fire together, wire together. And you're finding ways to get new firing patterns. So, can you give us a brief overview of that?
First step is to identify the correct patient because this doesn't work for everyone. So you got to define it. Is this chronic pain from an undiagnosed physical problem? For example, here in the medical clinic, a lot of people say, I hate the term non-specific low back pain. I hate that phrase. In my experience, most of the time there is a cause. It just isn't medically recognized or it's the wrong specialist looking. So first identify the problem. Is this a physical problem? Or if it's not, then is it from the brain? In which case now we can talk about rewiring. So we look at patterns of pain. We look at the type of pain. We look at is there emotional stressors? Is there triggers? Is there something more than just the physical cause of the pain of this? So once we identify the correct patient, now we start looking with them. So we start with what's called pain neuroscience education. So it's a new concept, comes out as heavy in Australia and it's starting to come in the US. We first you start addressing patients' emotions and their feelings about pain, their thoughts about pain. A lot of people feel pain as a bad thing, but pain is a protector. Pain is there for a reason. Pain is to tell you that there's danger. What we're now recognizing the danger doesn't have to be physical, it can be emotional. So there's new functional MRI studies showing that the brain can't tell the difference between physical pain, emotional pain, or imaginary pain. There's been studies and they light up the same part of the brain, lights up. The brain can't tell the difference. We also know the brain can cause pain, any type of pain, anywhere in the body. The brain can do what it wants. So it can create symptoms in your back, your neck pain, but it can cause dizziness, it can cause TMJ, it can cause headaches, it can cause irritable bowel syndrome, pelvic pain. It can cause all kinds of things that just don't have a really good physical understanding of it or how to fix it or how to treat it. Nothing works for everything. No one likes everything. So we try to find something that works for that particular person.
So, let's say that you've got someone that maybe their pain wasn't very easy to identify, and let's face it, we know what medicine does. They try to mask it, right? They can give some pretty strong drugs, sometimes some highly addictive drugs. So I'm imagining you have some of those people come in. So how do you help them get through that and off of those medications if that's their goal?
The first step, like I said, is identify them. Once you're convinced yourself, the provider has to be convinced, because if you're not convinced, you're not going to get that message across to the patient in a compassionate manner. They're going to think you're just another doctor blowing them off, telling us in their head. So in the past, it used to be if doctors didn't know what was wrong with the patient, they told them it was in their head, psychosomatic pain. Turns out now that they were right for all the wrong reasons. So it was not in their head, it's in their brain. So once you're convinced of that, and there's an evidence list you can walk through, the pain pattern, like I said, the type of pain, the timing of the pain. Once we identify that, then you sit down, you go over that list with the patient. You identify, you say, look, I'm thinking this is the actual cause of your pain. You have very real pain. The pain is real, but it's not coming from where you think it's coming from. So instead of your back, which is where the pain is, there's nothing actually wrong with your back. It's coming from this brain from a previous injury, and your brain hasn't let this go. There's something else wrong that's triggering this brain in survival mode. So we often ask, okay, besides for your back, what else is hurting your life? Was this happening at a time of emotional stress? Was this an anniversary of an event? For example, there was a case study. There was a Vietnam vet that was shot and was helicoptered off the battlefield. And 20 some years later, he was walking around downtown with his wife and suddenly got excruciating pain where he'd been shot for no apparent reason, just suddenly out of the blue. And it was so bad, he went to the ER trying to figure out that there had to be something wrong. In the process of talking with the doctor, his wife commented that, oh, by the way, we heard a helicopter going over. The moment he heard that, he realized that there was a helicopter, it was a brain connection. The brain had connected, heard the helicopter, connected back to the past event, and caused the same pain. The moment he heard that, the pain disappeared. So it can be from an anniversary event, it can be a brain, it doesn't have to be actual physical. So once we make that connection with the patient, once we help them connect that the pain is real, it's not coming from where they think it is, and there is something we can do about it. Now we can work with how do we treat that?
Let me just take a strange deviation there because probably most people listening or watching have heard of something called phantom limb pain, right? So someone has an arm amputated, but yet they swear that their finger hurts really, really bad.
And that's exactly what this is.
The way they solve it, is they actually put a mirror, right? And they retrain the brain in saying, hey, that finger's okay, even though they're seeing a mirror image. So retraining the brain for pain has been around for a long period of time. I want to dive in a little deeper, but we're going to go to our sponsor real quick, bettercoffeeshop.com. If you do have a physical cause of your pain, this coffee with reishi infused, by the way, the best organic coffee in the world 2 years in a row, actually modulates the inflammatory process by over a dozen mechanisms and is proven for severe pain like rheumatoid arthritis and fibromyalgia. Bettercoffeeshop.com. Try a box of the best organic coffee in the world today. So now, how is your procedure similar to phantom limb reeducation, or is it?
Very similar.
Okay.
So instead of taking a mirror and showing that finger, we start with, I use a process called pain reprocessing therapy, developed by Alan Gordon at the Pain Psychology Center. And it's been since validated by Dr. Howard Schubiner, and a few others have done a lot of research. And they've shown that this is becoming the gold standard for rewiring the brain. So they start with safety messages. First, you got to give the patient something to deal with the pain now. So first, you got to retrain the brain that it is safe, that there is no actual danger. So we do what's called safety messaging. So we have the patient literally look around. They use an analogy of a lion in the room. Is there a lion in the room? Is there a danger? No. So tell your brain you're safe, you're fine. And there's different ways. We have the patient create their own safety message, what resonates with them. If everyone's different, so it has to resonate to them. If they don't believe it, it's not going to work. Once we get the safety messaging, they start noticing that they can actually start controlling their pain. They can start down-regulating that pain with messages once they start telling the brain it's safe. And it takes time for the brain to start believing it. But once they do that, they start seeing change. And all they're doing is telling the brain they're safe. And that blows their mind. That's when you get them. That's when patients finally start believing this, when they see a change. For example, Dr. Schubiner uses a process where when he's interviewing the patient and they're not convinced that this is happening, what I have them do is he will have them imagine a situation that creates the pain. Imagine raking the yard. Imagine lifting up your grandchild. Imagine something that normally causes your pain. Just imagine it. You're not doing it. Just visualize doing that. And a lot of times that alone will trigger the pain. And that also will make it real. The patient, that just their brain, just thinking about it, caused it to happen. So first we start with safety messaging. Then we move into what's called somatic tracking. Now we start making them aware and comfortable with the pain, recognizing the pain is a signal. It's not a danger. It's not actually damage. Nothing's actually wrong. They can move. So a lot of people with chronic pain develop these bad movement patterns. They start moving inappropriately, trying to avoid the pain. And that develops gait problems and lifting problems and a lot of other issues that perpetuate the pain. So we got to break that pattern. So we start with somatic tracking. We start with just simple things like guided imagery or mindfulness. We just have them be aware of the pain. We guide them to see the pain from an outside perspective. So instead of feeling the pain, look at it as someone else looking at your body. Look at it from the outside. So take the emotional component out of it. You're not feeling the pain. You're just aware of the pain. You're looking at the pain. Yeah, I have pain in my back. Okay, describe it. Is it dull? Is it sharp? Is it dull? And as you walk through this cognitive exercise, it helps it make it less personal and more cognitive, more third party to the person. So that downregulates the pain again. Pretty soon they can do these images and do these safety messages and they can shut their pain off. And then as they get better and better, the pain starts disappearing because the brain is starting to feel, okay, I am safe. I don't have to trigger this pain reaction. I'm not trying to tell you that there's a danger because there's no actual danger. Then we move into what's called graded exposure. Then we start provoking it. So now we've calmed it down. We've gotten them used to it. Now we're going to provoke it because now we want to go on the offense. Now we want it better. So now we start putting those situations that used to cause the pain. But the trick with this is as you do this and you gradually do it, you don't base it off of the amount of pain that they're feeling. You base it off the amount of fear that they have with it because the fear that's driving it. So we have them go mow the lawn, go spend time with your grandchildren, go do something, start slow, but base it off of, okay, start fearing it. Then you back off into the visual imaging, you back off into safety messaging. You remind yourself that you're fine, you're safe to do this. And as I do that, eventually a lot of people, the pain just shuts off. So people have had pain for years can have total elimination pain. So in chronic pain, as you know, we've never talked about eliminating pain. We talked about managing your pain, reducing your pain, like you said, covering up your pain. But now with this new understanding, in certain circumstances, we can actually talk about eliminate pain, get rid of your pain. We can rewire it so it's gone. And we always warn everyone that will be relapses. The brain never goes without a struggle. So towards the end, it always will fight and it will relapse, or like the guy for Vietnam, you can have another event that triggers that reaction. And so I always tell patients, you did it once, you beat it. It can happen. You now know that. Just do it again. And it gets easier each time.
You know,
So,
it's
well,
fascinating because there's spillover. You're almost giving them a homeopathic dose of the threat
yeah.
so they get stronger again. So some people would use the term inoculate. I only use the word vaccinate. That's a dirty word for good reason. What they've done to vaccines is a crime. That's my opinion, and I think a lot of listeners might agree with that. But when you take a small dose that you can tolerate and move forward, so I can see people, I think it's critical that they get buy-in. First session, you show them that they can get some relief. How long is that per session? How many sessions would a typical chronic pain patient need?
So the pain reprocessing therapy process, the PRT, is based on 8 to 16 weeks. Some people see it immediately. Some people it takes time. Everyone's different. But the first time we spend an hour to 2 hours with them to spend time to educate, to do a full thorough exam. So we cover every stone, uncover every stone. We look at everything from a medical perspective and from a chiropractic perspective. Part of the problem with this being accepted is in the chiropractic community. I've been really trying to promote this within the physical medicine world and the chiropractic world because we are kind of on the same side of the patients. We're used to hearing and medical doctors saying this is all in their head. And so when chiropractors tend to hear this concept, they tend to immediately want to throw it out. Oh, it's just another way of saying it's in your head. And so, unfortunately, with some of the original research, the original research, some of the factors that they identified as from the brain are known mechanisms within physical medicine that we know have physical causes. For example, being susceptible to weather changes. They would say, "Oh, that's from the brain." Well, we know that's direct changes in the receptors within the joints that react to the barometric pressure. We know a known mechanism for that. Tension headaches. They like to say a lot of headaches, which can be from the brain from tension and stress, but we also know it can be a joint fixation in the cervical neck. You know, we know that there is actual physical causes to this. So the problem is with the community, we're trying to in this role that yes, We need to leave no stone unturned to actually look for the physical problems. Rule that out. Once we rule that out, so there's three types. There's physical chronic pain, there's brain chronic pain, and then there's a hybrid mixed. And that's most people. Most people have, there was some physical that started this. There's often an underlying problem that didn't get diagnosed. For example, from a chiropractic perspective, the joint dysfunction. That isn't taught in the medical community. They don't know to look for it. So a lot of times we can see that being a problem. The interesting thing that Heidi Havoc and some of the neuroscientists have discovered that chiropractic manipulation actually does change the brain wiring. It does this neuroplasticity, it rewires the brain. So we've been doing this from the beginning for 100 years. We just didn't know it. So, well, part of why chiropractic works is from rewiring the brain.
Yeah, I wanted to throw in, we're always rewiring our brain. Everything we do, we're either reinforcing a pattern, which is going to thicken that pattern and make it easier to fire. And by the way, when you're having chronic pain, your body gets good at creating that chronic pain. And so the pattern does need to be broken, and there does need to be some rewiring. I'm pretty amazed. So first session, 1 to 2 hours, 8 to 16 weeks. And if you were to say, let's say you identified the right patient with that type of brainogenic pain, cerebrogenic pain, I don't even know what the heck to call it, but it's not coming from the body. It's faulty wiring, faulty perception. What success at 8 and 16 weeks are you having? Is that 50%, 80%? Where are we at in terms of people getting better generally?
Well, first, I apologize that you're right. I didn't define the terms. So we call it, there's a bunch of terms for it. I like Dr. Schumer's term neural circuit pain,
Okay.
neuroplastic pain, nociplastic pain, brain pain. So, but yeah, so for example, I had a case a couple weeks ago, fibromyalgia case. She'd been diagnosed with fibromyalgia. For 4 years. She'd been having ongoing pain that was just getting worse and worse. No one could find anything wrong. She did have a few trigger points, but she did not meet the criteria for fibromyalgia. Once we explained this, in 1 week, she was 50% better. In 2 weeks, she's pain free.
Wow. Now, if anybody's suffering from fibromyalgia, that's unheard of. That's really epic.
It is. Now she was good. That wasn't the best, but that she's good.
Right.
Other people it takes 3, 4, 5 weeks to kind of get the process. But so far in my experience, I've had at least 50% better within those 8 weeks. I've had at least some change, which for chronic pain people is huge. If they're even happy, the trick actually with them is not be happy with 50%. Keep going, get better. They're happy to just have 50% relief. They think that's fabulous. So what started this, there's a famous study called the Boulder study that kind of started this, and where they did the functional MRIs where they could actually see the pain in the brain. They took, I believe it was 80 patients that had chronic pain for at least 10 years or more. They didn't care what cause. Any pain that had had chronic pain for 10 years or more that had not been responding to any treatment. So it was back pain, it was neck pain, it was fibromyalgia, it was pelvic pain, it was a mix of pain syndromes. They did these functional MRIs. They did an 8-week course of the PRT, and then they redid the scans, and they showed all of them had brain scan changes. The brain was firing differently. You can actually see it on MRIs. That's part of what convinced me, is that you can actually see these changes. You can see the wiring happening. What was amazing was that 75% of the patients had elimination of pain. Now, as you know, and there's never a pain study ever that had 75% elimination, not relief, elimination.
They reduce it 75% to be the biggest blockbuster ever.
Right. So
5% with 100% relief? That's amazing.
it was unheard of. And so obviously it got mocked quite a bit. It got challenged quite a bit. Because the other part of it was the few percentage that didn't get 100 elimination of pain had at least 50% reducing the pain. There were only 2 people that didn't respond, and it turned out later they had other physical problems that got undiagnosed with further study that shouldn't have been in a study to begin with. So there's never been a study like it. It blew the mind of the world, of the medical community. And so since then, it's been reproduced and it's been copied into the similar outcomes. So there's something, this is very real, and it can help a lot of people with very good outcomes.
Well, that is beyond amazing. So now when we start looking at that, and from your initial criteria, you said you want to pick the right patient. So the only 2 patients that didn't succeed were not right for that particular therapy.
Correct.
It sounds like 100% of people responded, and a huge portion had total resolution.
Right.
Now the major question is, can you do this virtually?
Yes.
You can?
Really.
Well, I'm going to have you announce it right now. What is your best website? How do people reach you?
It's marimanhealth.org. health.org. Merimen means to treat in the Coeur d'Alene language.
I didn't catch what it means in the Coeur d'Alene language.
All right. It means to treat or medicine
Or to treat. Okay.
in the tribal language. Yep. So it's merimenhealth.org.
Now, you do a lot with the tribe. And that seems to be part of your calling and your mission. Share that, please.
Yes, it's been a long-term dream of mine to work in an integrative setting, and so I got the opportunity almost 10 years ago to come to the tribe here. They wanted to add. It was the middle of the opioid crisis at that time. This area had a huge opioid crisis problem. There were high prescribers, and so the tribe recognized that this is a problem. And so they changed their entire providing staff, and then decided, okay, it's not appropriate to just take away the opioids. The people have pain. They were getting the opioids for a reason, so we got to do something about it. And the providers got together and decided that, let's look at chiropractic. And so they hired me to bring in and create the chiropractic department and to expand it from there to help address the opioid crisis. And so my mission when they hired me was to reduce the well, I can't affect the prescribing, but reduce the need for prescribing and reduce the use of the opioids. And so we've done that successfully, and to the point that we've added another chiropractor, and we're looking in 3 years expanding to even a bigger department. So it's been fabulous to help this great group of people that have, we're in the middle of nowhere in northern Idaho. So there's not a lot of resources out here. So to be able to do this for a group of people that just don't have many other options is very rewarding.
Well, you have such a paradise there. I see it expanding. I've only seen pictures of Coeur d'Alene. I've got a good friend that I've never visited there, but he's got a nice place there. And I hear it's an absolute place of beauty. And now with a lot of Californians moving in, who knows, you might become one of the largest states around because I know you have a lot to offer. But I want to go back to just a professional tip. You said something very, very powerful. Because of your background, you actually speak the language of the people that you want to synergize with. And that's critical. So, if I'm a chiropractor, and I am, and I don't have much of a medical background, I actually studied medicine so I could talk to them very effectively. I can't really expect to speak their language or earn their respect because, if I talk about a subluxation, they don't have a clue. Well, we're not getting very far. But if we talk about joint dysfunction, articular dyskinesia, inflammatory process, fibrosis, then we're speaking their language.
Correct. Absolutely. You guys, and that's why I love working with the medical residents. They almost all do rotations with me when they come through in the rotations. And it's very wonderful though, because they have a lot of curiosity. They want to know. They've heard about chiropractic. Some of them have been there, but they've never seen it from the provider perspective. So they're blown away with our physical exam and our palpation skills. And they love to touch patients. They don't get to touch people, so that's a new experience for them. And invariably, after the rotation with you, they always want to know, how do I refer to a chiropractor, and what do I look for? How do I look for who to refer to? So,
And what advice students are speaking there? That if people are listening, how do they find a chiropractor? How do they refer? What advice do you give?
I tell them to go through the ACA website and directory. That's a part of the largest professional organization. There's the ICA as well. I always tell them, talk to someone they know, someone they trust, and say who's good, who do they like. It's word of mouth.
Yep, word of mouth is my favorite, and I often tell people go into a holistic health food store,
Yes.
and if they don't know of a chiropractor, they haven't been there very long, or there's just not a good one around. you know, because we people that we see have so many healthy habits that we're going to find them in spas and health food restaurants and places like that. I'm looking at our timer here, and this has been one of the fastest, nearly 30 minutes that I've ever had. So I want you to take the next minute or two and just share whatever message you want about chronic pain, how it can be solved with your therapies, how people can reach you. And I love the message of hope, and better than that, the tools that you've mastered to help people get better.
Thank you, Dr. Bob. I appreciate that. And this has been a fantastic time with you. Thank you. My biggest message is just that there is hope for chronic pain. We have a much better understanding now than we used to. There are options available that work fantastically, that aren't hard to do. They're simple, but not easy, if I may. There's not complicated, but it takes work and there's time, but there is hope. So find someone that does chronic pain work with pain reprocessing therapy, CBT, guided imagery, virtual reality, meditation. There's many modalities that can affect it. Just find something that works for you and something that can help coach you.
By the way, I might even suggest that there are people that actually have good, real physical causes for their pain, but working on the brain still helps that too.
Absolutely. Thank you.
You're welcome. I'm going to wrap up with these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. If you've got chronic pain, reach out to Dr. Ryan Kane. We're going to put his link in there. Try it virtually. Hey, I'm telling you, if you've been suffering, this is a path out. And with that functional MRI study, wow, you are on to something epic. Now we got to let the whole world know.